horizontal plane determinants. In the horizontal plane, the movements that we will be concerned with are the working and balancing movements. In the working and balancing movements, the condyle on the one side in the balancing movement comes downward, forward, and inward. In the next movement, it will come in a pure rotation. If we view this schematic drawing of the maxilla and the mandible in the horizontal plane, we can determine the effects of the movements in the horizontal plane on the ridge and groove direction. These effects may be due to either geometric factors or anatomic factors. The geometric factors involved are, first, pure rotation. In lateral movement, we find that the rotation occurs around the working condyle, which rotates, and the balancing condyle comes forward, inward, and downward. And this would be a working movement, where the teeth on this side would be in a working movement, and the teeth on this side would be in a balancing movement. So we will observe this side, and this is the movement of the teeth in a working movement, and the effect that this rotation, just pure rotation of the working side, has on the ridge and groove direction. We notice that the mandible moves and the maxilla stays still. On this drawing, we can observe the effects of the cusps and the occlusal surfaces. The red lines represent the path of movements of the mandibular cusps against the stationary maxillary occlusal surface. The blue lines represent the path of the stationary maxillary cusp against the moving mandibular surface. These are the working paths. In the balancing movement, observe this side again. You would find that the opposite condyle now is the rotating condyle, and this condyle would come downward, forward, and inward to give us our balancing movement. And interferences towards the mesial inclines on the maxillary tooth. The effect on the lingual surfaces of the maxillary anterior teeth can be shown in this diagram. The wider the intercondylar distance, the more lingual concavity we would need in the lingual surfaces of the anterior teeth, whereas the narrower the intercondylar distance, the less lingual concavity required in the lingual surfaces of the upper anterior teeth. The third geometric factor that can affect the ridge and groove direction in the horizontal plane is the facial position of the teeth. In most mouths, we would find that the teeth are either closer or further apart, away from the rotating centers. As we see in this case, these teeth are closer to this rotating center than the teeth on this side. These teeth are further away from the rotating center. This has an effect on the ridge and groove direction. Also, the bicuspids here are further away from the rotating center than the molars. So this would have effect on the ridge and groove direction. Also, a tooth or teeth may be closer to the midline on one side than they are on the other. the restoration that we made on this articulator, the fact that it is in the center of the articulator and it is the same distance from the condyles on the articulator, and it's a shorter distance than it is in the patient's head, we would have the ridge and groove direction designed in this area, so that when we put it back in the mouth, this area would be in error or interference. We'd have to adjust all of this area in the mouth. Another thing that the facial position causes a difference in the ridge and groove direction due to the fact, as we said, that it is further away from the condyles in the bicuspid area than it is in the molar area. As we can see here, the ridge and groove direction, the angle between the working and balancing would be more acute in the molar area and more obtuse in the bicuspid area. The first of the anatomical factors that affect the ridge and groove direction in the horizontal plane is the side shift of the mandible. The side shift of the mandible has to do with the relationship of the lateral walls, or the lateral portion of the condyle, against the lateral walls of the condylar fossa. If we have no side shift, as represented by the green line, we would have a certain ridge and groove direction, and then if we increase the side shift, as we have in the red line, we would have a different ridge and groove direction. This is the pattern that the mandible would follow if there were very little or no side shift of the mandible. If there was a side shift, the condyle would move laterally more as it would move downward, forward, and inward. The effect that this would have on the ridge and groove direction can be shown in this diagram from the textbook. Here we have the situation with no side shift in A, and this would be represented by the line A in the working and balancing movements. If we had increased the side shift as represented by C, this would be the line represented by that movement. As we see here, we have this immediate side shift, and then the condyle moves downward, forward, and inward. So this would give us a wider area in the central portion, just as we came out of centric. This would represent a very distributed type of a side shift, where they would be evenly distributed throughout the movement. This also has an effect on the anterior teeth. If we had a very slight amount of side shift, as we have here in A, we have very little side shift. This would be represented by this. If we increase the side shift, we would also have to increase the lingual concavity of the maxillary anterior teeth. So the more side shift we have, the more lingual concavity we would have to have in the lingual surfaces of the anterior teeth. The working condyle movement in the horizontal plane has an effect on the ridge and groove direction and also on the lingual surfaces of the anterior teeth. The working condyle can not only rotate, but it can move laterally, and it can move straight laterally, laterally and forward, or laterally and back, as is represented by these three colored lines here. If it moved along the green line, it would be moving straight laterally. If it moved along the red line, it would be moving laterally and forward. If it moved along the blue line, it would be moving laterally and back, and this would have an effect on the ridge and groove direction. In a straight lateral movement, the working condyle would move in a straight lateral direction. In a lateral forward movement, the working condyle would move laterally and forward. And in the lateral and posterior movement, the condyle would move laterally and back. In this diagram from the textbook again, we can see the effect that the movement of the working condyle would have on the ridge and groove direction. Here we have the condyle would move laterally, straight laterally, laterally and protrusive, and laterally and in retrusive. And this would be the effect on the working and balancing movements and on the upper and the lower teeth. We can see here that if the condyle moves laterally and protrusive, it would tend to move the grooves more to the distal on the lower. As it would move laterally and retrusive, it would move it more towards the mesial on the lower. The reverse would be true on the maxillary. As we went laterally and retrusive, it would move it more towards the distal, and lateral protrusive would move towards the mesial. The lingual surface of the anterior teeth are also affected. As the condyle moves laterally and in protrusive, it would cause or require more lingual concavity of the lingual surfaces of the anterior teeth. In the sagittal plane, we have three variables that we are concerned with, and these variables can affect the cusp height of the posterior teeth and also the lingual concavity of the upper anterior teeth. These variables are the condylar inclination, the plane of occlusion in the posterior teeth, it's the plane of occlusion, the curve of speed, the cusp angle, and the cusp height. The anterior teeth, it's the amount of overlap of the anterior teeth. If we look at this formula that I'm sure you've seen before for balanced occlusion, now in the natural teeth we do not want to have a balanced occlusion on the posterior teeth. So we would want to modify these variables to get our clearance of the posterior teeth. Now if we look at the first variable, the difference in the condylar inclination, or the effect of the condylar inclination, if we have a normal condylar path, which is represented by the red condylar path, and we make a protrusive movement using this, we find that the posterior teeth should clear. Now, if we use a steeper, or the patient has a steeper condylar inclination, such as in the green path, this means that we can put in a steeper cusp, or the cusp angle can be steeper. If we have a shallower condylar inclination, we would find that we would have to shorten the posterior teeth because they would clash in a shallower condylar inclination. If the resultant path of the movement of the condyle on the patient were curved, and the articulator, which most articulators are the condylar inclination would be straight, then we would follow a path such as this on the articulator, and it would give us a lesser condylar inclination. If we put it back to the mouth and the patient followed a curved path, it would separate the posterior teeth more and give us more clearance on the posterior teeth. However, if we were going to balance the occlusion to where in protrusive the posterior teeth are to contact, this curvature of the condylar path could be significant. The condylar inclination can also affect the lingual concavity of the maxillary anterior teeth. The lingual concavity of the anterior teeth is the area we're talking about here, of the upper anterior teeth. This is where the lower anterior teeth, the incisal edges, guide across these surfaces for our incisal guidance, which passes through the distal of the second molar. And this acts as a plane, and this is what we refer to as the plane of occlusion. Now within that plane, we have a curve that is formed by the individual cusp tips, and this curve we term the curve of speed. Now we can vary these, or these can be varied in order to balance the occlusion, or in nature, as I will show in a clinical case, these can change to where they cause interferences in the posterior teeth. If we look at the plane of occlusion, this has an effect on the cusp height. the more divergent, or the further this plane of occlusion varies with the condylar inclination, to the condylar inclination, the steeper the cusp can be. The more divergent the plane of occlusion is from the condylar inclination, the steeper the cusp can be, or the more clearance we'll have in the posterior teeth. Now, as we raise the plane of occlusion, as represented here, the closer it becomes, or the more parallel it becomes to the condylar path, the shorter the teeth or the posterior cusp must be. So the higher the plane of occlusion, the less chance you're going to have for clearance, and the more interferences you're going to have in the posterior teeth. Now, if we look at the plane of occlusion, again, if we keep the condylar inclination the same and the anterior teeth the same, and we vary the plane of occlusion, we saw the effect of varying the condylar inclination, the different condylar inclinations on the cusp height of the posterior teeth. We varied the plane of occlusion and the curve of Spee and saw what effect it has on the cusp height. Now we want to see what effect the incisal guidance has on the posterior teeth. This is a normal horizontal overlap of the anterior teeth. In centric, the lower anterior teeth contact the lingual surfaces of the upper anterior teeth, so that in any movement, as soon as movement starts, the guidance from the anterior teeth separate the posterior teeth. We have now increased the horizontal overlap between the incisal edges of the lower anterior teeth and lingual surfaces of the upper anterior teeth. We have increased the horizontal overlap of the anterior teeth. So now in a movement, we'd have to move horizontally before the tooth would contact the anterior teeth and then separate the posterior teeth. The more horizontal overlap that we would have between the teeth, the shorter the cusps of the posterior teeth must be. Or if we increased the horizontal overlap of the anterior teeth, we'd come into more interferences on the posterior teeth. In this situation, we keep the horizontal overlap constant, and we increase the vertical overlap, or we increase the length of the tooth. And this would have the effect of when we moved in a protrusive movement, it would cause more separation between the posterior teeth. So the more vertical overlap that we have, the more, or the steeper the cusps can be on the posterior teeth. The determinants of occlusion in the frontal plane can be observed as the patient moves into a working and balancing movement. The working movement is when the buccal cusps of the lower move over the lingual cusps or buccal cusps of the upper. That is, the right-hand side is in working movement, the left-hand side in working movement, the left-hand side is in balancing movement, and so on. Here the effect of the working condyle and the balancing condyle come into play. If we view the schematic drawing of the teeth and the temporomandibular joints in the frontal plane, we observe the contact relation between the teeth. We have the condyle in relationship to the fossa. we have the space for the meniscus in between. We note here that this area is concave so that it can influence the lateral movements of the working condyle. If we view these movements of the working condyle has a potential of going straight laterally in a lateral movement. It can go laterally and down, or it can go laterally and up, and this would have a definite influence on the teeth. So if we move laterally in a normal movement, we would find then that the teeth on this side are in a balancing or idling movement. This condyle is in a balancing movement. This condyle is in the working movement, and these teeth are in their working relationships. Now, if we had a condyle, a working condyle, that went laterally and down, as it moved laterally, we would see that it would cause more separation between the posterior teeth. If we had a condyle that went laterally and down, we could have steeper cusps on the posterior teeth. If we had a working condyle that moved laterally and up, we could see the effect then on the posterior teeth. We would see that if the condyle moved laterally and up, we would find that the posterior teeth would clash. So if we had a condyle that moved laterally and up, we would have to have shorter cusps on the posterior teeth. Movements in the frontal plane also involve the side shift of the working condyle. The effect on the cusp would be if you had a cusp that was designed with less for a minimum amount of side shift, and in reality the patient had some side shift. If we make a lateral movement and watch the teeth, we would see that the normal amount of side shift of the patient, the cusp would clear. Now, if we had designed a restoration on an articulator with a minimum amount of side shift, and we put it back in the mouth, and in reality the patient had some side shift, we would find that the teeth would clash. Or, if you increase the side shift, you should decrease the cusp height. So as you increase the side shift, you should decrease the height of the cusps. Now, if we refer to the diagram from the book, to summarize the determinants of occlusal morphology, there are certain determinants that affect the ridge and groove direction, and there are certain determinants that affect the maxillary teeth different than the mandibular teeth. Those determinants that cause the distal movement of the grooves, the working and balancing groove on the maxillary teeth, cause them to move distally, would be the tooth being closer to the rotating centers, the tooth being closer to the midline, the greater intercondylar distance, less side shift, and a working condyle that goes laterally and posteriorly. Those determinants that cause the grooves to move mesially on the upper teeth would be working condyle that would move laterally and anteriorly. Those determinants that would cause the grooves to move distally on the mandibular teeth, this would be your balancing on the mandibular teeth, this would be the working movement on the mandibular teeth. Those determinants that would cause the grooves to move distally would be the tooth being closer to the center, rotating center, tooth being closer to the midline, having a greater intercondylar distance, less side shift, and a working condyle that would move laterally and anteriorly. Those factors that move the groove mesially on the mandibular teeth would be a working condyle that would move laterally and anteriorly. Those factors affecting the cusp height and the fossa depth would be the height of the cusps, how high the cusp can be, and the depth of the fossa. Those factors that would cause a shortening of the cusp height would be a shallower condylar inclination, a greater horizontal overlap of the anterior teeth, less vertical overlap of the anterior teeth, more side shift, the occlusal plane being raised, an increase of the curvus B, and a working condyle that would move out and up. You can increase the height of the cusp by a working condyle that moves out and down, and also by increasing the condylar inclination. Those factors that affect the lingual concavity of the maxillary anterior teeth, the lingual concavity that we talk about starts from our centric contact and is the area incisal to that. We would deepen or make shallower this lingual concavity. Those factors or those determinants that would cause an increase in the lingual concavity of the lingual surfaces of the maxillary anterior teeth are a steeper condylar inclination, an increased intercondylar distance, a condyle that moves laterally and up, a working condyle that moves laterally and anteriorly, and an increase in the side shift.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.